All right, let's dive into colonoscopy prep. We know you're probably getting ready for your colonoscopy.
Oh, absolutely.
And let's face it, the prep isn't exactly fun,
No, not really anyone's idea of a good time.
but it's so important for keeping your colon healthy and preventing colon cancer. So we're here to make it easier.
Yeah, we'll break it all down so you feel prepared for every step.
Exactly. So we're taking a close look at the SUPREP prep process. It's the one outlined by the Three Rivers Endoscopy Center. Think of this deep dive as like your roadmap to the prep.
Yeah, makes sense. And, colonoscopies are the gold standard for detecting polyps, and that's what helps prevent colorectal cancer. And for the doctors to do their job properly, they need to see the whole colon.
Yeah, it's got to be clean. Imagine trying to find a tiny seashell
Okay.
on a beach that's covered in seaweed. That's what it's like for the doctor trying to spot polyps in a colon that isn't totally clean.
Oh, I see what you're saying.
So the prep is all about getting rid of that seaweed so the doctor has a clear view.
Makes sense. A clean colon, accurate exam. That's what we want.
Okay, let's dive into the timeline. It all starts 3 days before your colonoscopy. No liquid diet yet, but you do need to start eating light. Here's a little tip to remember what to avoid. If it would leave a lot of residue in your blender, it'll probably leave residue in your colon. So
Interesting.
things like raw veggies, corn, seeds, and anything with skin, like tomatoes or cucumbers.
Right, those are all off the menu. Yeah, those foods can be harder to digest,
hmm
and they can interfere with the cleansing process.
2 days before your procedure, you can enjoy a normal diet. But if you struggle with constipation, the source recommends taking some milk of magnesia after dinner. And then we get to the day before the colonoscopy. This is where the clear liquid diet officially begins.
Okay, the clear liquid diet. So we're talking like broth, bouillon, black coffee or tea,
hmm
clear juices, but without the pulp.
hmm
Jello, popsicles, yeah, anything you can see through it.
Right, and hydration is key. You need to keep those fluids flowing. Throughout the entire prep process, at least 8 ounces of clear liquid every 2 hours while you're awake.
Yeah, think of it like a marathon for your insides. Staying hydrated helps everything move along smoothly.
Now let's talk about the star of the show, the SUPREP solution.
All right, the SUPREP.
It comes in a 2-part kit, and you'll start with the first half around 6 p.m. the day before your colonoscopy. You mix it with water. The source even suggests using a straw to make it easier to get down. After that, you'll drink another 32 ounces of clear fluids over the next hour.
And to minimize any nausea, the source recommends taking an anti-nausea medication before you start the SUPREP, like Zofran.
Good tip. Now let's fast forward to the morning of your colonoscopy. No breakfast allowed, but you will take that second dose of your anti-nausea medication. Then 5 hours before your scheduled appointment, you'll repeat the mixing and drinking process with the second half of the SUPREP solution, followed by, you guessed it, another 32 ounces of clear fluids.
Okay, and this leads us to a really important window. For the 4 hours leading up to your procedure, you can't have anything to eat or drink, not even water.
Wow, nothing.
Yeah, this is super important for your safety during anesthesia.
So it's non-negotiable. You can still take essential medications with a small sip of water, but for those on diabetes medications or blood thinners, it's important to check in with your doctor for specific instructions.
Yeah, they might need some adjustments in the days leading up to the colonoscopy. Always best to err on the side of caution and talk to your doctor.
Speaking of dietants, you'll need a driver.
Right, the driver.
And they're not just there for the ride. They need to stay at the facility throughout your procedure.
That's right, they'll drive you home. But they can also discuss the results of the colonoscopy with the doctor while you're recovering. Sometimes, patients aren't quite ready to drive themselves home right away.
Right.
So having that driver is essential.
And they can be a great source of support. Now, how can you tell if your prep is actually working?
Well, the source says when the fluid you're expelling is clear and yellow, like urine, then you're good to go. That yellow color comes from bile, which is perfectly normal. But if you're still having solid or brown stools on the morning of your colonoscopy, it's important to call the office.
Right. Don't hesitate to reach out if you have any questions or concerns.
Now let's talk about diabetes. Managing your diabetes during the colonoscopy prep requires extra attention.
Absolutely. The dietary changes can lead to unpredictable blood sugar levels, so close monitoring is essential.
Yeah, the source really emphasizes the risk of hypoglycemia, and they offer specific recommendations for adjusting various diabetes medications during the prep process.
Okay, so let's break down these recommendations. First up, metformin. What's the advice for folks taking this medication?
Well, the source suggests stopping metformin when you start that clear liquid diet the day before the colonoscopy. You can resume taking it once you're back to eating regular meals.
Okay, that sounds straightforward enough. What about medications like Ozempic, Rybelsus, Wegovy, or Trulicity? I know those are pretty popular these days.
Right, those are GLP-1 receptor agonists. They basically help your body produce more insulin and lower blood sugar levels. And the recommendations for those kind of depend on whether you take a daily pill or a weekly injection.
Okay, so different forms, different adjustments.
Exactly. If you're on a daily capsule, the source says to stop it 24 hours before your colonoscopy.
Yeah.
For the weekly injection, you'd stop a week before.
Got it. Now, what about other types of diabetes medications?
For DPP-4 inhibitors like Januvia, Tradjenta, and Onglyza, you'd stop taking those on the morning of the procedure, and then you can resume them that evening. If you're on SGLT2 inhibitors like Jardiance, Farxiga, or Invokana, you'd stop 3 days before your colonoscopy and resume once you're back to eating normally and you're well hydrated.
So many specifics to keep track of.
I know, right?
What's the main takeaway here?
Well, I think the main thing is that these medications can really impact your blood sugar levels, especially when combined with the dietary restrictions of the PrEP. The goal is to prevent hypoglycemia, low blood sugar, which can be dangerous.
That makes sense. What about insulin? That seems like it would require even more careful management.
Oh, absolutely. Insulin adjustments need to be super individualized, based on your specific insulin regimen and diabetes management plan. The source really recommends consulting with your endocrinologist or primary care physician for personalized guidance.
So working closely with your doctor is key here.
Yeah, definitely. But just to give you a general idea, the document does offer some starting points. For those using rapid-acting insulin with an insulin-to-carb ratio, you can usually continue your normal dosing strategy. However, if you use fixed doses for meals, you'll need to significantly reduce your dose during the clear liquid phase.
So adjusting based on what you're actually eating. Or drinking, I guess.
Exactly. As for basal insulin, that's the long-acting insulin that helps regulate blood sugar between meals and overnight. The source generally recommends reducing your dose by 20 to 50%, starting the day before the procedure.
Wow, that's a lot.
It is. But again, this is just a general guideline. The specific adjustment will depend on the type of basal insulin you use and your individual needs.
Sounds like open communication with your healthcare providers is so important during this whole process.
Oh, absolutely. They're your best resource for navigating all this and ensuring your safety and well-being.
Now, beyond the medical stuff, the Three Rivers Endoscopy Center also highlights some practical tips for a smoother experience.
Right, like having a driver.
Yeah.
And making sure they stay at the facility. They'll be able to discuss the results with the doctor and make sure you get home safely afterward.
It's also important to arrive on time with your insurance card and any required copay. And they even recommend wearing comfortable clothing. No need to add any extra discomfort to the day.
And speaking of comfort, have you thought about what you might bring to the waiting room?
That's a great point. The source doesn't mention this, but it's a brilliant idea.
Yeah, the waiting room can sometimes feel a bit like limbo. So having something to help pass the time and ease anxieties can really make a difference.
For sure, bringing a good book, your favorite podcast, or even some calming music can make the waiting process much more bearable.
It's all about self-care.
Yeah.
Make this experience as positive as possible. You've put in the work with the PrEP. Why not treat yourself to a little mental escape while you wait?
Exactly. Okay, to recap, we've covered the importance of a clean colon for an accurate colonoscopy, the step-by-step SUPREP PrEP timeline, medication management, and the considerations for individuals with diabetes.
We've also highlighted the importance of your driver and bringing something comforting to the waiting room.
And above all, we've emphasized the importance of clear and open communication with your healthcare providers. They're your best resource for personalized guidance and support.
And remember, while the PrEP may seem challenging, it's temporary and the benefits are long-lasting. A successful colonoscopy can really give you peace of mind about your health.
It's true.
And it can potentially prevent a serious condition.
That peace of mind is worth it. It's worth all that effort. So, as we wrap up this deep dive, here's what we want you to remember. Timing is everything. Make sure you follow that SUPREP timeline closely, starting those dietary changes 3 days before your procedure. And don't forget about hydration.
Yeah, keep those fluids coming. It's crucial for a good cleanse. Think of it as flushing out your system to give your doctor that clear view.
Exactly. And if you're on any medications, especially for diabetes or blood thinners, talk to your doctor. They'll give you personalized guidance and help you manage your meds during the PrEP.
Your doctor's your partner in this process. Don't be afraid to ask any questions you have.
We really hope this deep dive has given you the knowledge and confidence to approach your colonoscopy PrEP like a pro. It may not be the most fun experience, but it is so important for your health.
We're wishing you a smooth and successful colonoscopy. And remember, early detection is key when it comes to colon cancer. By doing this, you're taking control of your health and well-being.
Exactly. And hey, take care and best wishes for a smooth procedure.